Hello, my guest today is Dr. Niall Finlayson, the former president of the Royal College of Physicians in Edinburgh. The Royal College was founded in 1681, and there are 12,000 members worldwide practicing medicine. Today, we're talking about food, faith, and health. And I wonder about how faith might impact, Neil, your daily decisions as a citizen, as a doctor, as a member of the community. How does faith or belief or spirituality influence some of the decisions you make?
Well, I think here one is talking about faith more broadly and not necessarily any specific religious faith. Um, and in addition, I think that faith here recognizes belief in something which you can't actually prove, but which you feel there is sufficient evidence for you to have confidence that you can believe in those principles. And I think that this must surely be important to almost anyone, for I think it must be unusual to find someone who believes in nothing at all. So I would say that my particular faith, which is a Christian faith, um, clearly must affect your decision about things every day. Of course, you often don't think about things specifically because you respond automatically in terms of your faith. But when you have a problem, then I think the principles of your faith must be at the root of allowing you to decide whether you will go this way or whether you'll go that way. And I don't see how that can be anything other than that for almost anybody.
And then, how do, for example, when you worked with patients on a daily basis, how do patients sometimes explain to you in subtle ways their own beliefs and their own faiths? For example, you told me years ago about a gentleman who had a very severe drinking problem. And I believe that over the time that you spent with him, you finally had to be very direct with him as a physician about uh, his habits and how they had to change to preserve his life. Is that just an act of medical knowledge, or is that an act of faith, spirituality, belief? What made him change his lifestyle?
Well, I suppose at the end of the day, um, you never actually know because I think in this area between doctor and patient, at least in my experience, you rarely have a patient speak to you directly about their faiths, whatever that may be in. Usually it comes in hints, and clues, and attitudes, and all you can do is sort of pick that up. In addition, I think it's very unusual, and in my case, never happened, that I would say to a patient, well, my belief is based
Mm.
in Christianity. Um, so really it was more what hints you had about their, their faith. Now, when you have something difficult, like, say, in most cases that I dealt with, it would be alcohol abuse, you never knew whether the patient's beliefs were strong enough to allow them to overcome their problem with alcohol. But for these patients, that was important because continued drinking in, implied a very high risk of a bad, maybe death, ending. But I think here, one of the things that's important is that the doctor extends to the patient the knowledge that however difficult it may be to change your way of life, the doctor and those who work with the doctor, nurses and so on, are on your side. We understand your difficulties. We don't condemn you for the past. We encourage you for the future. We can overlook relapses, although we would like to see that reform linked to new effort. And I think an important part of perhaps what could be broadly called your own faith and the faith of the people you work with, whatever that may be, which can almost translate into the attitude or faiths of the unit, lets the patient know that whatever their resources are, to the extent that it's humanly possible, they have your resources as well as their own.
So it's really a partnership between physician and patient, isn't it?
Yes, I think for people who have chronic, long-standing disease or serious disease, which I would mean these are diseases which change your life or even end your life. I think the best possible outcome for a patient is to have doctors and nurses who extend to the patient the support that they can give them in dealing with what I would call the anguish of disease. Mm-hmm. I should say, in addition, the doctor and those working with the doctor extend this to the patient, but we also have to be prepared to extend that to the patient's supporters, their friends and their family particularly.
Speaking of supporters, Neil, how does the physician work with the hospital chaplain? So whether they're Christian, Jewish, Muslim, etc., is there any interaction between the physician and the chaplain in terms of the care of the patient?
I think it depends. Obviously, what one means by the term care. If one means the specific care of the patient, which I would take to be the medical care, you know, what is it best to do? When is it best to do it? Perhaps even more important, what is it best not to do? Mm-hmm. That's a decision which doctors and nurses cannot shuffle onto other people. Mm-hmm. Along with the patient and their relatives, doctors and nurses need to shoulder this responsibility. But I think once the decision is made, then more widely, the very important help can come from chaplains. And of course, which chaplain may help you is twofold, actually. First of all, obviously, it depends on the chaplain having the same kind of religious faith as the patient. But also, it comes from an assessment of the personality of the chaplain. You may just find that a chaplain of a different denomination or a different faith may actually offer you as much or more help as the one you might more naturally go to. Here the choice has to come not in terms of the label of the chaplain, but who the chaplain actually is. More difficult is how do you decide whether to involve the chaplain? And here I would only emphasize here that you have to really get to know your patient. And that means actually speaking to the patient. Maybe speaking repeatedly. Maybe setting aside time to do this. And gradually out of this comes your feeling that maybe the patient might be helped by the chaplain or a chaplain or the hospital chaplaincy, which is somewhat wider. And so this may be proposed to the patient, but of course, obviously in the end result, it's up to the patient as to whether they accept that decision or not. But I don't think this is a decision that can be taken lightly. I think it can only be taken by physicians and nurses who know very well the patient and the patient's problems.
Interesting you mentioned this point about sometimes it doesn't matter if the chaplain is the same faith as the patient. It's really the relationship, the rapport, the vibe that they have with them. When my father had a massive heart attack at 65, I visited him in hospital, and he said the strangest thing happened to me this morning. 6 men came from the First Baptist Church with their minister, and they stood around my bed and they asked if they could pray for me. And he said, I told them I'm Jewish. And they said, we know, and we love you, and we want to pray for you. Would that be all right? And he said, absolutely. And so I said to my father, how did you feel about that? He said, how do I feel? 6 strangers I had never met before came over to this hospital simply because they loved me. And he said, no one else has done that today. What's not to love about love, right?
Yeah.
And so I think finding the right person, the right relationship is really important. I wonder how faith uh, potentially could impact one's physical and mental health. I happen to practice mindfulness, which is not really about faith, it's more related to meditation, being in the moment. But I also pray every morning, and I believe it makes me feel better. It might just be my own psychological makeup. Do you think there's any link between some of these alternative therapies, such as meditation, mindfulness, even prayer, and physical and mental health?
Mm-hmm. Well, in some ways, actually, you get onto slightly firmer ground here because there have been a number of studies looking at the possible health outcomes of what you might call traditional religious faith or traditional or lack of traditional religious faith. Now, I don't claim for one moment to have a close knowledge of this literature, and I have only read commentary on it, although I think reasonably informed commentary. And I think there is quite a body of evidence that suggests that people who have a particular faith, a more traditional religious faith, do in general derive physical and mental benefits in terms of wellness and longevity. Now, of course, an interesting question, particularly for doctors, is what is it in that condition of religious faith which seems to confer these fairly clear benefits in terms of mental and physical health? Is it the actual faith itself, the details of the faith itself and the observance that it brings about, or is it some byproduct of, if you like, the faith condition? And no one knows the answer to this, but I think even at the most basic level, there are reasons to believe that the kind of life people who have a faith lead may well have health benefits. For the first thing is they usually belong to a community.
Mm.
And from that community, they have personal and community support. And we know that that's important for mental health. Secondly, the nature of most faiths means that they practice moderations which are benefits to health. For example, gluttony is avoided, and they tend not to trouble with problems of, say, obesity. they avoid alcohol, or they only drink restricted amounts of alcohol, or they may not smoke. And in addition, they may feel that because they owe their body a debt, that they will do some exercise. So when you put all these things together, a way of life that involves a community, that involves moderate eating, moderate drinking, moderate or preferably no smoking, and a bit of exercise, you could take that package and remove it from faith, and it would still confer a benefit. And of course, there's still a possibility that in addition, faith in some way we don't understand actually also confers a benefit as well. So I believe that actually there are many factors in faith that if you happen to have faith, the consequences of that may be beneficial to your mental or physical health. Now you can go beyond that and say, that's a case of, does faith help you maintain health? But the second question is, what about faith when you become ill? Mm-hmm. That's really a test of faith, because it raises the question, why me? Why hasn't my God protected me against this? God is not there to protect us against illness. But when illness comes, if faith is deep enough, it can help us bring us through the period of illness, whether that ends in cure, in disability, or in the end of life. So I think there are benefits. Let me just say about that, though, that I don't think that if one is a person, say, have a Christian or a Jewish faith, that one should be, if you like, selling that faith as a means of living a longer or more comfortable life. It isn't, because one of the problems about faith is that when you enter it, it doesn't make your life easier. It may make it a lot more difficult.
More complex, that's sure. It's interesting you mentioned this point about socialization and longevity of life and quality of life. I've read similar studies that when people become older, if they continue to socialize, they're part of a community, generally it may help with the maintenance of their health. And in the Jewish tradition, I don't know if you know, I believe the same thing is true in some other faith communities. It is considered unholy to have a tattoo, to do anything that defaces your body, because the belief in the Jewish tradition is that God has given you one body, you must take care of your body. So that supports what you were saying earlier about sometimes there's some aspects of religion or faith that might remind people that you have to, exercise, take care of your body. But as you say, one size doesn't fit all. Every person has to make their own decisions. My final question has to do with decisions you've had to make in your career. How, Neil, have you used your faith to handle situations where, despite your best efforts, either your patient has not recovered or not improved in any measurable way? How do you put on your jacket and go back in that hospital the next day and treat that patient or other patients when sometimes you have your own challenges?
Well, you point to a very difficult situation in which doctors find themselves again and again. And usually one hopes in life that as one deals with difficult situations, it gets easier and you get better at it. My experience is that it gets more difficult, and I'm not sure that I do get better at it. But I think here, at the end of the day, one has to ask, what is it that the patient wants or needs from the doctor? And obviously, the patient wants a doctor who is conscientious and who attends to every aspect as far as he or she can of the needs of that person's diagnosis and treatment. A doctor who is knowledgeable and keeps his or her knowledge up to date, and a doctor who is skilled in every technical procedure that relates to his or her medical practice. And obviously, each patient wants you to apply that conscientiousness, knowledge, and skill to them. But when that has been done as well as you can, and there is no resolution to the situation, I think then the patient wants a doctor who doesn't say, well, I'm sorry, but I've done all I can. There is nothing more I can do. The answer is, there is something more that you can do, and that is, there is nothing more that medical science or technology that I can offer you, but what I offer you is my continuing care of your illness. I am with you, and I and the team I work with are with you right until the end. And that means that when you need me, I or a member of my team will be there, even if there is at an inconvenient time for me, which may be in the middle of the night or at the weekend. And so I think what we offer our patients in that extreme situation is actually, yes, we're offering ourselves to take every opportunity to make things better, but more than that, and what the patient appreciates more than that, is that you offer yourself. You offer yourself. You stand next to them. So there's an old medical saying which says, the duty of a doctor occasionally is to cure, often to alleviate, but always to comfort. And I think that that is what the patient who has a fatal illness, that you can do nothing to stop the illness ending their life. You can do quite a bit to make the endurance of that illness a whole lot easier. And whether it's during the day and the week, or whether it's in the middle of the night and the weekend, you will abandon other obligations in order to attend to that patient's needs. And I couldn't emphasize that more strongly.
I can't imagine a better motivation for returning to the hospital each time. And I know from previous discussions with you, many times that was for you during your career in the middle of the night or on weekends or on holidays, because even though you couldn't necessarily provide a cure, you could always provide comfort. And on behalf of the Edinburgh Interfaith Association, I want to thank you very much for contributing to our discussion about faith, health, and food. And I want to remind our viewers that if they're interested in further information about the excellent work of the Royal College of Physicians in Edinburgh, they may visit www.rcpe.ac.uk. That's www.rcpe.ac.uk to learn about their very valuable programs. Niall, I've known you for a long time, and I've still learned a lot from these discussions today. So that just shows that there's a lot more to learn from Niall Finlayson. And I hope that we have the opportunity to keep learning together so that hopefully, as you've suggested so passionately and wisely today, we can be of service to others. Thank you, Niall.
Thank you.